restricting it. We're going up on the policy. Restricting it. We're going up on the policy.
Here. Ms. Carr, you slipped up and said something earlier that was very telling. You said, we're going to pass. It hasn't been to a vote yet, that increase. But you said in the affirmative that that's what y'all were doing. I find that very interesting, as if the decision had already been made prior to the vote. Those were your words.
So do I have a motion to approve moving that level from 100 to 200,000?
I move to approve it.
Okay, Mr. Larson, second, and all in favor of that? Okay. Forward then on the number 8, the discussion and possible action on appointment of a manager to fill the vacancy on the Board of Managers. I would like to tell you that our enabling act does say that we have 5 board members, and so that's why we always do keep a 5 board member panel. And so that is what we will continue to do. And I'll tell you that we go exactly by the Texas Health and the Safety Code, Health and Safety Code rules, and that it says that providing a vacancy on the board of a hospital district can be filled for the unexpired term by appointment by the remaining members of the board. We are going to do that tonight. We all were looked at separately, just trying to find, people that would really loved Huntsville, loved the hospital, and loved to help people to be on our board, and that's exactly what we tried to look at when we did that. We have made an appointment. We all were looked at separately, just trying to find, people that would really loved Huntsville, loved the hospital, and loved to help people to be on our board, and that's exactly what we tried to look at when we did that. We have made an appointment. We are going to vote on Dr. Stephen Antwi tonight, and I would just need a motion to vote on appointing Dr. Stephen Antwi to the Walker County Hospital District Board of Managers to fill the vacancy that was created by the resignation of Dr. Lane Aina. We have all of our board members present now, so I'm going to call the meeting to order. And if you will look under tab 2, the minutes for the regular board meeting on January 27th, and see if you have any corrections or any additions to those minutes.
Second.
Okay, all in favor? Okay, we'll move on to the comments from the public. And let's see. First one is, is it Tom? Tom, Mrs. Bench. Let me go with that one. Okay.
Good evening, I'm Tom Aaliyah Bench, and I first of all want to say thank you for the opportunity to speak to you tonight. And that this is the public comment. I noticed that it's not the conversation with the public, so I ask that you will not converse with me while I'm speaking to you, because I know that there's some other people who have signed up, and I don't want to intrude upon their opportunity to speak to you as well. So I'm just going to express my opinions based on observations. I'm going to address agenda item number 7. And so last month on your agenda, it was the same number. It was review and consider expanding the indigent care policy. And I took some notes. I don't take notes in full sentences, so apologies for the grammar. Indigent care policy discussion. Client base has been small. Expand indigent care for those missed. The missing people, suggestion to increase to 151 to 200% of the FPL for 6 months. Capture 584 more people. There was a review of denials. Suggest to seek improvement of the claim application completion to reduce those denials. Suggest marketing to inform the community, and outreach by nursing staff to organizations that they deal with also. So those are the notes that I took last time, and what I wanted to focus in on is your suggestion to increase to 151 to 200% for 6 months. Yes, ma'am. So you taped it, right? Yeah. He taped it. So when that was said, that sounded to me like it was a trial period. You know, like I'm shopping for a new car. You go out, you get into the new car, you drive it around, you decide you don't like it, you walk away. There's no strings, no hindrances. But I want to posit to you that even if you do this for 6 months, this increase, there are strings, there are hindrances to decrease it. So even after a short temporary time, if you change your mind, numbers are coming in, and it's not working out right, you can't just back down to the current level of 100% of the FPL. So in your policy, that thankfully it's available on your website, page 8, section 11, Roman numeral XI. This is a procedure to change the eligibility or services provided. Pursuant to section 61.063 of the Health and Safety Code, the Walker County Hospital District Assistants, I'll call it WCHDA, may not change its eligibility standards to make the standards more restrictive and may not reduce the health care services it offers unless complies with the requirements of this section. Number 8, publish notice of intent to change. Post notice in newspaper 90 days before the date on which a change would take effect. This notice of the proposed change must be published in a newspaper of general circulation in the hospital service area and set a date for a public hearing on the change. The published notice must include the date, time, and place of the public meeting. This notice is in addition to the notice required by Chapter 551 Government Code. B, public hearing. The WCHDA shall have a public hearing no later than the 30th day before the date on which the change would take effect. The meeting must be held at a convenient time, in a convenient location, in the hospital service area. Members of the public may testify at the meeting. So I like to see that we are allowed to comment. I think that convenient time and location is subject to interpretation. What's convenient for one is not convenient for all. So I kind of look at that one to wonder where you would be able to schedule it. I don't personally consider this convenient. C, formally adopt the policy change. If, based on the public testimony and on other relevant information, the WCHD board finds that the change would not have a detrimental effect on access to health care for the residents the WCHD serves, the WCHD may adopt the change. This finding must be formally adopted. So by looking at your policy, this is not something that you could arbitrarily go up and down. And this is the reason why I'm asking you, don't make this change at this time. You made the change in November of 24 to go from 50% to 100% of FPL. And that was in 24. I've got right here the most recent annual financial report that's been audited. And that's year end, December of 24. So I don't think that you've been at your 100% long enough. I would ask that you would delay this increase. Thank you for your time.
I do want to apologize because what you understood the 6 months on the agenda and on tonight's agenda also, we were going up for good. It was not 6 months, so I apologize. You understood that.
Well, and even so, that you're making it permanent.
Yes. Well,
And
yes,
if
we are.
you decide,
Yes.
if you decide what I have just
Yes.
said holds true.
Exactly.
There are strings.
We have gone down once before when CHC first came in, so we went through all of that. So we do understand all that, but we're going to offer it to more people, and so you don't. You
Yes,
can
ma'am.
merely vote.
Are you going
So-
to allow another person to now speak?
Yes, I am.
Okay, great.
But I wanted to let the group know we are not constricting it. We're going up on the policy. And I'm so sorry you thought 6 months because it's really
You
for
did
good.
tape it, correct?
So
Yes, thank you.
But he taped it and we do too. But I'm saying we're not going to constrict it. We're going up to get more people, actually, so that will help more people. And that's what our goal is. So, okay. Next, let's see. Mr. Tor, is it? Tor, okay. Foster. Foster. There you go.
So, thank you for the opportunity to speak here.
Yes, sir.
I have a question. I really would like to understand what going from 100% to 200% above poverty, you're expanding the eligibility. And I had a short discussion with Jerry earlier today about that.
Okay.
But what does this, how does this benefit the hospital? It's not the hospital corporation, not this corporation, but it's the hospital that benefits from this.
It's
Is
the
that correct?
people that will benefit.
Well, okay, so does that mean that more people will be able to get free health care?
It's a policy, it kind of like an insurance policy. And Paul, you might want to address that too, with what it does for the people, because Paul is in charge of that at the hospital. But yes, we want to include more people. We want to get more clients. It is like an insurance policy. We help the people through all those stages with this. So if we went up to 150%, it would help about 310 or so more clients, but 200% would help 800 more clients to get better health care. It's not free health care, it's better health care.
So who pays for that free health care? How does the money flow? Does it flow from the federal government, the state government, from the taxpayers of Walker County?
No, it's going to be from the district, and it is budgeted, and it will not make us go over our budget at all, because a lot of those patients, tell me if I'm wrong, they go into charity care, and so we're helping more people not going into the charity care. So, and we have it budgeted, and it doesn't affect at all our budget.
So you will not have to raise taxes?
No,
to
we
do
will
this?
not have to raise taxes to pay for it. We have the money to do it. Why not help more people? You know, why not? we have it budgeted to do.
Does it help the cash flow of the hospital?
Cash flow?
Not really.
I mean, I don't know how to answer that.
It allows us to have the patients treated instead of it being uncompensated bad debt.
Yeah.
We break even. So it's just
And the people that can't afford it.
So it allows us to see more patients without them having the burden of trying to either getting billed. Okay, once they qualify, you're not going to bill. You're not gonna get collection letters. It just, it gets adjusted as a charity write-off for this program.
The money comes from somewhere, and that's what I wanna know.
Yeah.
It's gonna come out of the pockets, if it's coming from the hospital, board, you have a tax revenue, and that means it's coming from the residents of Walker County.
Of
Right.
course,
Yes.
of course,
Yeah.
always, of course.
Okay? That's my point. I'd
We
like to
will not
see-
be going over anything though, we have it budgeted
But I'd
already.
like to see the figures on that. Is that gonna be posted on the budget?
It is posted on the
Yes, we
budget,
can see
it
it.
already is, yes it is, sir, yes.
Thank you.
Thank you, Mr. Foster. Awesome. Okay. Denise?
Yes, I would have liked to be able to speak on that too, but I didn't have, I had to miss the meeting last month for
Okay.
a work related event.
Sure, sure.
Which I was chastised about when I called to ask for the minutes. Yes,
No, you
I
were
was.
not.
I was told that if I would attend the meeting, I would know what had been spoken about. That's what you told me.
That's after you told me a lot of rude things on the phone.
No,
Yes,
that
it
is
was.
before I got rude with you.
I'm not arguing.
So I would have liked to have information on that before I came today. That way I was, better informed about that item agenda. But I didn't have it because the meeting minutes are not available till 35 to 40 days after the meeting.
After they're legally approved, and then we post them, yes ma'am.
Okay, so my coming to you today is why not post the minutes with a stipulation at the top that says unapproved minutes until the next meeting. That way when or the general public can't be at a meeting, we know what was spoken about. Because this agenda doesn't tell me anything that's posted on your website. I have no idea what was discussed, and I can't find out till 35 or 40 days later. Okay? So either
We'll look at that.
record the meeting
And we do record all the meetings.
You video the meetings?
Not video,
Okay.
we record.
So video the meetings and add a little tab next to the agenda meetings, put, recording, and upload that so we can go back and watch it. Or upload unofficial minutes so that we can know what was discussed. Because for me to have to wait 35 to 40 days, I don't think is being transparent, this word that's been going around.
Yeah, a lot.
Yeah, because it's true, like, I had to be at a work event in March, I have to be at a work event, I
Right.
can't be here. And I was told that if I would attend the meetings, then I would know what was going on. And I have been at the meetings previous to
Yes,
that.
you have. I
Okay.
agree.
I was here when
agree.
nobody else was.
Right, exactly. I agree with that.
So for me to be told that is unprofessional. And so that is my suggestion to you as a
We will take
board,
that into
that we
consideration.
have better, because I can't speak on any of this today, because
Right.
I don't even know what was discussed last time.
Right, I understand. Okay. And last but
And I
not
would
least,
like to,
Donna.
on that thing also, is I would like to know y'all's term expirations, because it's not on the website anywhere. I
Oh,
looked at your
okay.
bios, and it's not on the website anymore.
Okay, so
My
Joe,
term- My term is
Yeah.
November.
This November?
it is on the website.
Joe
She
said-
says-
Where is it on the website?
It is on
It's
the-
not under the bios. Where the
No,
bios
it's
are.
on, I believe it's on the front page, but it is.
I looked and I didn't see it, so I apologize.
I can
if
print it
is.
up, show you.
Okay, I apologize if it is, but if you could just go around and tell me.
So Joe,
November 26th.
Joe Sapp, CPP.
Mr. Larison?
I'm what, 2 more years?
yeah, November 28th. 28th and 28th. The three of us are all the same, November 28th.
And the person that you are appointing to Dr. Leonina's position will have to be at the November election.
Absolutely. We do everything by the law.
Okay, yeah, I know.
Okay. All right, anybody else? Wait, Donna, you're next.
I'm gonna just piggyback on her comment. There are 2 taxpayer-owned facilities right here in Huntsville where you could live stream and have video records of these meetings that would make it much more transparent.
And we can look at that. I did say we would look at that. We've never even been asked.
This is my time. Is that
Okay,
right?
sure.
Those facilities are available. They're already paid for by the taxpayers. I would appreciate if you would look into it.
We will.
Transparency is a problem. I'm gonna also piggyback on, I do not wanna see that increase from 100% to 200%, but I'm actually here to talk about number 8, the possible appointment for the vacant position.
Oh, yes, ma'am, yes.
I think there are 2 compelling reasons why you should not be appointing a replacement. First one is, in your website, in your documents, I did a deep dive. The 3-year span from January of 23 through December of 25, the meeting minutes reflect that more than 40% of your meetings, 1 or more people are not here. So you're very accustomed to doing business with only 4 people. If you then factor in how many times people are not physically present during the entire meeting, either they show up late, well after the meeting has started, they leave early, or they're here by phone, that pushes you beyond 50%. So more than 50% of your meetings over a 3-year period, 38 meetings, you're very accustomed to doing it without a 5th person. So why the rush?
Our
That-
enabling act says we have to.
Pardon me, this is my time to talk.
Mhm.
It's not conversation time, it's public comment time.
Go ahead.
This is, we talk, you listen, all of you. So, there's not a rush to do this. No one knew about it until it came out on the agenda. No one has seen any social media posts, anything in the newspaper, nothing on the radio, that you were looking for candidates to fill this. So I have a concern that in looking through those minutes of 38 meetings, 38 separate meetings, 38 separate agendas, and all of those items, do you know that every single item on every single agenda, it says pass with unanimous votes? So we have a circular mindset here. Ms. Carr, you slipped up and said something earlier that was very telling. You said, we're going to pass. It hasn't been to a vote yet, that increase. But you said in the affirmative that that's what y'all were doing. I find that very interesting, as if the decision had already been made prior to the votes. Those were your words.
Mhm.
And they're on 2 videos.
Yes, I hold
So-
by it. I hold by it.
Yeah, the vote hasn't been taken yet,
I know,
correct?
I know.
So, all of that's very telling. I do not believe that this body should be appointing someone right now. The fact that you guys just spent $200,000 of taxpayer money
Mhm.
for 2 failed bond elections tells me that this body doesn't know what the public wants. How can you possibly appoint someone to represent the public? I do not trust your judgment, no offense, but I think y'all are out of touch. Thank you for your consideration.
Yes, ma'am. Okay, and so we talked about, well, we'll just go on. I want to start fresh with Demarius over here. I want to introduce you tonight to Demarius, and she is Amaya. She is our brand new accountant, and she started with us this last week or so, so she's very, very new. But she has her degree from Sam Houston University, which is great, in accounting in May of 2021. And she has had experience since that time, and she has gotten on board, and she is going well. She's doing a very good job. But she's getting to know everything about the district and about the IGTs and about everything. So it's a steep learning curve. So we're just very, very proud to have her tonight. I just want to introduce all of you to Demarius. So, we will go on then to the reports from the Huntsville Community Hospital Corporation. So you guys have the floor. Go ahead.
Thank you, ma'am.
Yes, sir.
It's been an exciting month. It's been busy in February. January was one of our busier months at the hospital with emergency department visits increasing and admissions increasing. February has been.
Terry, hold on one second. If people don't know tonight, because they weren't here last month, Terry Scoggins is our brand new CEO out at the hospital. He's an interim CEO, and he's took the place of Patrick. So I just wanted to let you know, Terry Scoggins is his name, and that's why he's here. I know a lot of these people work here,
Sure.
but may not know who you are.
I started on January 22nd, I believe, Wednesday. I've served in in Titus Regional, East Texas, Mount Pleasant was CFO and CFO from 2012 to 2025. I've done some work for towards some of the rural hospitals. So I love working with rural healthcare. I've enjoyed the last month. It's been a lot of fun to get to know Walker County and a lot of different people in Huntsville. Spent a lot of time meeting with leaders in the community, leaders in industry, the university, the medical staff, community members. So excited to be here and having a lot of fun. From a hospital perspective, it's been a busy month. In February, we've been running about 65 patients a day, which is up 4 to 5 where we've been. Year to date, we've been doing 62 patients a day. So it's been busy in the emergency department. Admissions have been up. We hit census of 100 in the month of February. So we are busting at the seams this month with January and February increasing. We were excited to have Dr. Pepper, our OBGYN, join us about 3 weeks ago. Had the opportunity to spend some time with him. Excited for him to be a part of Walker County. And as Walker County grows and more bursts and people move to the community, he's a great addition to be a part of the medical team at HMH. We're also going to see another family practice OB join us in the next few months as well. So really trying to improve and increase our OB and maternal service coverage in Walker County. Really excited about that. Also like to share with the board, this last week we did receive from the state of Texas our primary stroke certification. So we're excited about that. Cardiovascular stroke, 2 of the leading causes of mortality in U.S., especially in Texas, but East Texas and rural communities as well. So to get that primary stroke certification for another 3 years, kudos to the team. So thank you to our team for all the work they did in getting that from the stroke program. A lot of great things going. We're big believer in that program and excited that HMH is doing the stroke stuff. So having a good time, meeting everybody and learning a lot from that. So excited, appreciate the welcome meeting.
Welcome. Paul?
Good evening. So yeah, January, for most of us, that's where insurance is starting over. The deductible start over. So we expect to see certain things, elective things be down a little bit. We saw a little bit when it came to surgeries. It was a soft month with surgery, but we said overall we average 75 patients a day in the hospital. So we still stay extremely busy there. Surprisingly enough, diagnostic imaging services was busy. Not only is outpatient, inpatient, so we were busy with that. Montgomery had 17 deliveries in January. His relief is there. He hasn't got to hand them all off, but that's there. So overall, we're doing very well statistic-wise. Even with the hiccup with the weather that disrupted us a little bit, our volumes didn't drop off. And so, you know, we're very fortunate to have very stable staff all the way around with our people, and we continue to get the support from the organization, so that's been good for us. When we look at overall year to date, we're right at our budget number for this few 7 months of the year, so we are in a good position right now. Yeah.
I want to thank the board on 2 of our current major projects. Right now we have maker lab equipment that's getting installed. There will be some construction involved with that in the middle part of March. And that project will be completed at the end of March, beginning of April. We'll be on 2 entirely new chemistry analyzers in the lab. And the project is on time and on budget. We also have a new CT machine that is moving forward. All the plans for the mobile CT to be there as a backup and for outpatient, in addition to the other CT that we have for primarily ER and inpatient, will be available, will be installed, ready. All of our construction timelines and everything are on target. Delivery timelines are on target. So we expect that to stay on track, and I believe it is the end of April. I'll have to double check, but I believe it's the end of April that we'll have the new CT machine fully installed.
One addition to that, he did say a mobile CT with his backup, so you'll see that mobile CT in the parking lot. So I just want, if somebody asks what it is and why it's there, it's that backup to have. So you'll see that. So it'll be an 18-wheeler, and from there, it's planned. It's not. So
Yes.
It will worry some people when you see it from that one. So.
Okay, there you guys. Does anybody have any questions for them? Anybody? Larry? No. Y'all have anything for them? Okay, you guys can, if you want to, you may go. We will look under tab 5, and go for the monthly financial reports. This month, I'm going to go ahead and go over some of them with you because Demarius is brand new, so I'm not going to put her on the spot tonight yet. So we'll do that next time. But if you just look at the January actuals, the tax revenue, of course, this month in January was a lot because in December and January is when our board gets most of our tax money, and it goes off, during the year. So we received $2.6 million in tax revenue, which is the January taxes. And so we had delinquent taxes there, penalty and interest on the taxes, and then our lease payment. We received $200,000 a month as a lease payment. That's in there. Our interest income this month was good. It was $54,000, and our miscellaneous income was $16,008. And that was, Kelly, you were telling me that, yeah, the IGT money, we got back some IGT money that they gave back. So we had some miscellaneous income we did not expect. Tax refunds are there, and the gain or loss in the market is there. So we actually had a total income this month of $2.9 million, and again, that sounds like a huge amount, but also through the year that goes down and down so as we get the taxes as we go through the year. So it was a good month. And then the expenses, they're nothing out of the ordinary. The payroll expenses are there, $2392.34 FICA, and then the legal fees this month were $1,619. Office operations, usually office operations are fairly small, but we had some IT issues this month, and we had to have our IT group come back, and sometimes they help with the websites or to upload and do some things, do some cleaning up work. So that was in there. So that was $1,600. Our indigent care for this month was $49,118.65. And our rental is just standard every single month. That's our rental for our office. And the tax assessment fees for the Walker County a tax assessment, the CAD, was $14,009. That is a monthly expense that we have from the appraisal district. So that's will be standard every month. And so we had basically expenses of 71,000. So we had an income of 2.8. So again, with lots of taxes coming in this time of year, that was a good month. So is there any questions about any of that? It was a pretty same pretty much. We didn't have anything that stood out this month at all for expenses or for income. So that was different. You can look at that and see if you have any questions at all. If not, if you do, if you don't, I'll take a motion to accept those. Okay. All in favor? Jerry, did you get a chance to look? Okay. All right. And if you look under tab 6, will be the payment of the monthly bills. Sorry, excuse me. You see the bills, and you can look down the list there. Again, they're pretty standard for the month. Our AT&T bills are, the VIS Consulting is our IT company. That was a $1,205 bill too. Our rent, anything down there, QuickBooks, our payroll. Texas Comptroller was our IGT, is the Texas Comptroller. That's $49,000 in the bills, and the appraisal district, which is due. And the 28,000 to the Walker County. And that was on the tobacco, that's to the election. The election, the bond election was $28,170.28. So that made a total of $113,228.03. Any of those, Dan, anything of any of those that are not pretty normal, whatever that, that you want to ask about? QuickBooks, anything else? Any questions about any of the monthly bills?
Move we pay the monthly bill?
Okay, all right.
Second.
Second, and all in favor? Okay. We'll go now to the consider approving the indigent care poverty level. And yes, and I did probably say that we would, because last month we all said, the three of us all wanted to raise the limit already. We talked about it, and we wanted to raise the limit to help more people in Walker County to go to the 200%, and we all wanted to. But Mr. Larison wanted some more clarification, and so he called me today and he said, I've looked over everything, I have my clarification. So I knew that he was set to vote tonight. And so anyway, we are going to move to consider approving the indigent care poverty level, moving it from 100% to 200%, which will benefit 854 more families in Huntsville, Texas. So do I have a motion to approve moving that level from 100 to 200,000?
I move to approve it.
Okay, Mr. Larson, second, and all in favor of that? Okay.
Yeah, I'd like to do.
Yeah, go ahead. Go ahead.
A little history on that indigent care program from historical perspective. And Andy probably know more about this than I do, but I think that whenever Bob Hardy was here, we had consistently 300 or 400 people that were on the indigent care program, if I'm not mistaken. Is that about right?
When I came on the board, the poverty, it was 100%. That's what it was
Right.
when I came onto the board.
But we had
And it had been that, and there was 300 or 400 people on it at that, right?
And there had been some comments made that by the public that we weren't taking care of enough of the indigent care people.
That's right.
So that was one of the reasons that we went back and looked at, in conjunction with the hospital, how we could cover more people, because our numbers had fallen to double digits, I think, was it? And we weren't seeing that many people that were being covered.
That's right.
So when we talked with Paul and CHC to help us to look at what we needed to do, because we had it at 100% at that point in time.
It was 100%. There was a time when the hospital first, when CHC first came in and the hospital had just come from the other corporation had bankrupt. And so at that time, CHC, we were afraid that 100% we could not support, is what the hospital said. And they asked the district to go to 50%. And so we said, okay, they just were, they were coming out of bankruptcy. CHC was trying to get our hospital back going. And so we said, okay. And that's when, like as Ms. Finch said, we went through all of the things she read, and we constricted it down because we weren't sure, they weren't sure that we could do that they could afford it. And so we did that. But immediately when they felt like then they could get more people on, this is not secrety, this is not anything. This is exactly what happened. And when they decided, okay, we're making more money now, you can go ahead. We voted to go back to 100%. And so we did. And then now, still, and times are harder and harder for a lot more people. But we told them, we feel like we need to be meeting more clients. And they said, let us look at it, just look at it and see what we can do to help. Again, if they came back with us from CHC, from the hospital, and said, if you go to 150%, you'll reach about 300 and something more people, okay? And if you'll go to 200, you can meet 800, you can meet 850 something people. And so that is what we voted to do tonight. We're going to 200%. It was not a 6-month thing. It was for good, for as good. And so I am sorry that got out, that something about the 6 months. I don't know how that got there, but I'm just telling you the truth, and that's what we did. And so we're going back tonight to the 200%.
So the purpose.
But we will help more people.
Right, so the purpose was to be able to allow more citizens who are needy and who are at poverty level to have more access to the health care that they need as opposed to not getting it. And that's historically kind of where we came from and where we came up with those numbers. And after we talked with the finance department and with Paul and looked at the numbers, they felt like that with the budget that we had, if I'm not mistaken, correct me if I'm wrong, but with the budget that we had set aside for indigent care, that it would be enough to cover
Yes, it is.
that new amount.
Yes, it is.
Can I ask you a question?
Yeah, especially if we get.
Just so I can understand better, or not, I
Okay.
can wait till later.
Okay, go ahead.
So my question is, with the rising cost of everything in healthcare, how do you expect to be able to continue to provide for that number without having to raise prices for those that are paying for that?
No.
You know what I'm
That's a
saying?
good question. At the same.
Because I don't understand how it works.
I understand, but
Sure.
it gets confusing to me too, so I understand.
Yes, very well.
But the main thing with, it kind of, we organize it to where they'll start going to the clinic. Anybody can walk in the emergency room and get taken care of. That's what, if you look at it that way, you're right, it costs a whole lot of money for somebody to go to the emergency room. But if you can rewrite them through the clinics and take care of them like we're planning to
So
do.
this indigent care is for the clinic?
Yes.
Okay.
We push them towards the clinic
Rural
and
health.
try to keep them out of the emergency room. And we really save money by
We
doing
do,
this.
we do.
So, back in December, it was mentioned about the mobile clinics that y'all were using out in Riverside and stuff. Is that part of this?
No, and
also?
Denise, that was just something that was discussed before Patrick left. Those mobile clinics, the district had nothing really,
So
that was
y'all
a part
do
of the,
mobile
and so that's not,
Okay.
I don't know what that is their thing, and we haven't heard any more about those
Okay.
either.
So that's not a part of, because
No,
those
it
were
is
ones
not.
in rural areas that
No,
didn't have
it is not a
problems
part of
outside
it.
town.
No, ma'am, no, it's not. So, okay. Did that answer your
So I didn't know if
question?
that would help to have a little bit of historical perspective and to see how we kind of look at the numbers with the hospital to come to that 200%.
Well, thank you very much. And Jerry explained this to me that about having the clinic, and I discussed this with Ian some months ago, that having a clinic there where you can do a triage at the clinic, and somebody who's bleeding out on the floor, you go to the emergency room. If someone comes in with sniffles, you go to the clinic. Is that the idea? Yeah, exactly. That's very good. I'm glad to hear that.
And we've tried to set it up so that they can pre-register prior to going in. I think, was it 30 days ahead of time?
Yes, we made it because the policy did say they would get on the program as they went in. And we decided we would like for them to be able to, when they're not going in, to sit back and go in and get onto the program so that when something happens, they're already there. And so we changed the policy to do that. And so they can get on earlier.
How are you
So-
finding those families? Through the school district or?
Yes,
through-
and we will also be posting that on our website and putting it on our pages that we are going to the 200%. And a lot of our community do understand that because they've been on the program before. But we want to advertise that because now more people can get on. And so we will put it on all of our things, and I know the hospital they'll be putting it out too, so, yeah. Any other questions
didn't know if Ian or Terry wanted to add anything to what. Historically, I know Terry hadn't been that long, but I know Ian has probably worked with Paul in some of the conversations as well.
That percentage, there's a population that they work, they make money, but they don't make enough to afford insurance, or
Yes.
they've not provided insurance. They make too much to be eligible for Medicaid and other programs that are out there. And so we were finding that that percentage that is currently set was a lot of those clients were already receiving Medicaid benefits, and we've got a new program at the hospital that tries to identify folks and their eligibility for Medicaid programs. And so I think you saw the number
Yes.
on Indigent Care go down because we were moving them to other funding sources like Medicaid, but there was still this population that was coming in that did not have any insurance, was not eligible for these plans because they made too much but not enough. And so I think this is the population that this will now
That's right.
help cover. And you're right, Jerry, by having them be able to sign up ahead of time, we can direct them into the clinics, get them into that level of care, try and handle things more preventatively at a lower cost. The reimbursement, I think, is really just cost covering. So when they come in for a test or they come in for a scan, the hospital's not making a margin on that. I think it's just covering costs, but it is keeping them out of the emergency room. I mean, that's the plan, that's the hope, where the costs in the emergency room are exorbitant and the utilization is high. And so if we can reduce that, that's the plan. It does take partner physicians to be on the plan, the Indigent plan, as well as the hospital to make this work. And so we're going to continue to work to that effort.
I hope that helps him.
Thank you.
So, I have one other. This is a completely different topic. Just something helpful that Donna said a while ago. And that is that y'all know that I'm on the city council. And I cannot speak for the city council on this topic. But the new city hall, we anticipate it to be finished in late April. And there's a beautiful meeting room there with the dais and room for people to sit. And the city certainly doesn't use that all the time. And I think it would be very appropriate if you would like to approach the mayor and the city manager to see if you can use that space when you have your meetings, so you'll have all of the modern amenities that we like to have.
Exactly, that sounds good. That sounds good, we will certainly keep that in mind too.
Thank you. Thank you.
Absolutely, that was great. Okay, we're gonna move forward then on the number 8, the discussion and possible action on appointment of a manager to fill a vacancy on the board of managers. I would like to tell you that our enabling act does say that we have 5 board members, and so that's why we always do keep a 5 board member panel. And so that is what we will continue to do. And I'll tell you that we go exactly by the Texas Health and the safety code, health and safety code rules, and that it says that providing a vacancy on the board of a hospital district can be filled for the unexpired term by appointment by the remaining members of the board. We are going to do that tonight. We all were looked at separately, just tried to find, people that would really loved Huntsville, loved the hospital, and loved to help people to be on our board, and that's exactly what we tried to look at when we did that. We have made an appointment for tonight that everybody looked at their own different people, and we had people to come, and then so we will vote on that appointment for tonight. And I will let me go to here. Here, get this out and I'll see. We are going to vote on Dr. Stephen Antwi tonight, and I would just need a motion to vote on appointing Dr. Stephen Antwi to the Walker County Hospital District Board of Managers to fill the vacancy that was created by the resignation of Dr. Lane Aina. He meets the statutory requirements of being a resident of Walker County, and he also is over 18. So if I can have a motion then to appoint him to our board.
Can I make a?
Yes.
Can I interject something?
Absolutely.
I think for those people out here that don't know anything about Dr. Antwi,
Yeah.
he is a local person.
And I have a bio from him too.
He's lived in Huntsville all his life. If I'm not mistaken, I think his brother was on the school board. Is that correct?
Yes, he was. He was.
So
Yes.
they are. He's very aware of the. Of our environment and the needs, the health needs that we have here for our residents and our citizens. He is very conscientious about trying to take care of his patients. He's an ER doctor, I believe.
Yeah.
Oh, you have that.
Mm-hmm.
You want to read it to him?
Well, no, you were doing a good job. So
I don't know if I'm leaving anything out.
No.
But
that was fine.
May I make a point of inquiry? May I make a point of inquiry?
Wait till we're finished, and then you can. Yes, ma'am.
Does that have superseding right by Robert's?
Okay, Dr. Antwi has garnered a wealth of emergency medicine training and experience. He's been over 2 decades, worked in an academic level 1 trauma setting. He began his journey from into medicine from the perspective of health policy, earning his master's in public health from his alma mater, Columbia University in New York in 1995. He then returned to Texas and attended medical school at the University of Texas Medical Branch in Galveston, and went on to complete a dual residency in internal medicine and pediatrics in 2003. And then he decided to go into an academic mode, and he stayed in the facility in the emergency department and level 1 trauma center at UTMB after completing his residency. Dr. Antwi had a desire to, he said, help this community in healthcare, and he wanted to be a part of this board. And he is very well qualified, and he wanted to serve this community. He's just left the hospital board. I think he was chairman of the board of the hospital. Chief of staff. Thank you. I'm chief of staff. And so he has served very well, but he definitely wanted to serve and to help this community move forward in healthcare, which is what we all are going to do. So that's it. Yeah.
Point of inquiry?
So okay, so we voted. Do you want what? Yeah, go ahead.
It sounds as if you had a consensus. Did you have a
No, we did not have any kind of meeting, ma'am. Dr. Antwi came, and he wanted to be on this board. It is our thing to appoint it. No one else came.
Who did he come to?
He was in the hospital. He spoke to all of us. He wanted to be on the board. We're appointing him, and legally we can do that.
Were
And
you
so, okay,
together when
and
he spoke to you?
we're done.
So
No.
You spoke independently? That's the point of inquiry.
Yes. Thank you, ma'am. I appreciate it. Okay.
Anytime we can clarify that, yeah.
Exactly.
We knew that rule, and so
Yes.
he actually had a conference meeting with Ann and talked to her about herself.
He wanted to serve.
I've known Dr. Antwi for 25, 30 years, and when I was working at the hospital, he was the ER doctor there, and so he's expressed an interest in the board and also in the process of taking care of the patients here in the county. So we all do it with his interest. So that's how the name came up.
And this is just temporary.
Oh, yeah, this is till November, till November.
Yeah, till November.
Right, till November. He just fulfills the unexpired term, so. Okay, do I have a motion to vote on appointing Dr. Stephen Antwi to the board? Okay, second?
Second.
And all. Yes, all right. He will be here next month, by the way, and we will have him sworn in. Let's see. Yes, do I have a motion to adjourn? Okay, second, and all right, we are adjourned. Thank you for coming. We do really